is Leslie Pensa, and I'm getting my MPH here at UAB through the MD-MPH dual program. For my internship, I served as a diabetic educator in 2 clinics, Traffanstedt Internal Medicine in Hoover, Alabama, and Cahaba Medical Care in Centerville, Alabama. The 2 clinics were pretty different. At Traffanstedt Internal Medicine, it's a suburban clinic which mainly services patients that have good access to care and good insurance. At Cahaba Medical Care, they're a federally health qualified center and a patient-centered medical home. So for my role, I wanted to make sure that I was educating these patients according to their literacy and numeracy skills. So I would administer 2 different assessments that were both subjective in order to figure out where their baseline literacy and numeracy skills were. I also would incorporate other tools, such as asking them to read a prescription label, asking them to identify from a range of numbers which glucose readings were within range, and to read a calendar to see if they could identify when their appointment might be if we asked them to come back in 2 weeks. So at Traffanstedt Internal Medicine, because the patients did have a higher educational status, I mainly focused my efforts on carb counting. Most patients had never tried carb counting in the past, and it was a good skill that they had the skill set to be able to do. Whereas at Cahaba, a lot of the patients did lack in a lot of their skills. So for the 69 patients that I saw, 19% of those patients had limited literacy, 16% had marginal literacy, and the remaining patients had adequate literacy. So we were able to identify some of the barriers to them having controlled diabetes through understanding their literacy levels. Also, as a part of my internship, I redesigned the clinic's glucose log according to some of the CDC's recommendations to use color pictures to accompany medical text. And I eliminated the mathematical symbols such as less than and greater than to simply state them in words and lessen confusion among those with low literacy and low numeracy. Another major lesson I learned was that you can't necessarily equate someone's educational attainment with how well they function with their literacy and numeracy skills. It's important that we talk with all of our patients, find out where they come from, and meet them halfway when we try and educate or counsel our patients. From this experience and from my education within the School of Public Health, I've learned a lot about patient care, about how I can use my skill sets through my medical training and through my School of Public Health training in order to best serve my patients in the future.